For millions of people all over the country on Medicare, they find themselves running into unexpected costs and penalties when it comes to getting onto Medicare that nobody warned them about. My name is Christian Brindle. I'm a Medicare health plan expert and specialist, and I run a company called Christian Brindle Insurance Services, also known as Everything Senior Insurance, and we specialize in working with individuals on their Medicare health plans and maneuvering the maze that is Medicare. In this video today, we're going to be talking about unexpected costs, penalties, and everything you need to know when you're getting onto Medicare, why signing up at the right time can be everything, and why some penalties last for the rest of your life. You may have heard that you get late enrollment penalties if you don't enroll into Medicare at the right time, but did you know that these late enrollment penalties are for the rest of your life? Once you incur one, you can never get out of paying one while being on Medicare at the same time. And there's a couple of different ways that these actually get charged to you. So let's first start with original Medicare, Medicare Parts A and Medicare Part B. Those are the only parts of Medicare that actually come from the government. I like to refer to them as original Medicare, okay? Medicare Parts A and B, they work like two pieces of a puzzle that fit together to provide you with medical coverage. Medicare Part A famously covers hospital coverage. Medicare Part B famously covers medical coverage. Medicare Part A usually does not have any kind of premium attached to it as long as you've worked in the country for at least 10 years of your life, you or your spouse. Medicare Part B, on the other hand, does have a premium that everyone on Medicare is responsible for paying, and in 2024, at the time of recording this video, it's $174.70 a month. It's at this moment of recording this projected to go up to $185 a month in 2025, although we do not have those official numbers as of yet. Now, Medicare Part B issues you a late enrollment penalty if you don't sign up at the right time. The right time to sign up is when you first turn 65, you have essentially a 7-month window. 3 months before your birth month that you turn 65, the month you turn 65, and 3 months after. And outside of that time frame, if you miss that window and you don't enroll, you can be hit with a late enrollment penalty on your Medicare Part B premium. Now, if you're working and you have coverage through your employer, and it's an employer that has over 20 employees, typically that is looked at as credible coverage. Now remember, it has to be an active employer. A retirement plan does not suffice. But if you fall into that circumstance and that criteria, oftentimes you're able to postpone your Medicare while you have that credible coverage and not incur any late enrollment penalties. But if that is not you and you just forget to enroll and you forget to sign up, what typically happens is you get hit with a late enrollment penalty. For Medicare Part B, the late enrollment penalty is an additional 10% added onto your premium for each year you delayed enrollment into Medicare Part B. This penalty is compounded and stacked on top of your Medicare Part B premium, and is that much more for the rest of your life. The only way to stop paying that additional premium is to just get off of Medicare altogether. Now, some people have gone down that route before, but what you typically find is there's very few options in terms of health insurance that will accept you once you're eligible for Medicare. The system almost puts you in this mode where you have to get Medicare or you have very few options when it comes to health insurance. You cannot get on a marketplace plan or an Affordable Care Act plan when you're eligible for Medicare. You can't usually get on other types of health insurance plans like short-term care plans or a lot of other types of under 65 plans. Usually what you have access to is a retirement plan if you are qualified for one, a group plan if you're working, or Medicare in most cases. Now there's exceptions, like if you're a veteran or something like that, but even programs like TRICARE for Life for military veterans require you to get on Medicare, otherwise they typically will disenroll you from your TRICARE. So for most people that find themselves hit with a late enrollment penalty for their Medicare Part B, it's kind of a situation where you either pay it or you don't have any health care. Now, Medicare Parts A and B provide you with medical coverage, but not 100% medical coverage. They typically provide you with 80% medical coverage, and then they leave 20% behind that you're responsible for. But in addition to that, Medicare Parts A and B do not cover things like prescription drugs, dental, vision, or hearing. So they have what's known as standalone Medicare Part D, as in dog, prescription drug plans. They also have Medicare Part D coverage that's built into a Medicare Advantage plan. Regardless of how you get Medicare Part D, as in drug coverage, you can incur late enrollment penalties for that as well. That's separate from your Medicare Part B penalties if you don't enroll at the same time. The way that these work, it's calculated by multiplying 1% of the base premium of the national average of plans with the number of months that you went without your Medicare Part D prescription drug coverage. This, like Medicare Part B late enrollment penalties, compounds. The longer you go without it, the bigger the penalty becomes, and it's added on to your monthly premium of your plan, and it's that much more for the rest of your life, regardless of which insurance company you enroll with and regardless of what type of plan you enroll with. As long as it has Part D prescription drug coverage, the penalty will follow you. Now, this doesn't matter if you have a Medicare Advantage plan with prescription drug coverage or if you have a standalone prescription drug plan. Regardless, either way, that penalty is stacked on to the top of your costs every month, and you have to pay that much more for the rest of your life. The last unexpected charge that people on Medicare end up incurring that they aren't warned about often enough is the Medicare IRMA program. What is that, you might ask? Well, the Medicare IRMA program stands for Income-Related Monthly Adjustment Amount. Now, what this means is essentially if you are making too much money, if you have too high of an income, Medicare can actually charge you more for not only your Medicare Part B premium, but also your Medicare Part D as in dog premium. Both of them have an extra allocated amount that gets tacked on to the top of your normal costs. Sometimes people will refer to this as a penalty. Medicare does not like that terminology, but really, I don't know another way to really categorize it other than a punishment for making too much money. They base it off of what your income was 2 years ago at this certain year. So if we're looking at it in 2024 at the time of recording this video, they would be looking at your income in 2022. It updates and adjusts automatically every year. So next year in 2025, they'll be looking at last year's income in 2023, and so on and so forth. The numbers that they're projecting as of this moment at the time of recording this video to be impacted by an IRMA is $106,000 a year in income if you file your taxes as a single individual person, or $212,000 a year if you are married and file your taxes jointly. Now, there is a chart that actually determines how high you can go. There's different levels of IRMA you can be hit with. In some cases, it can be an extra $50, $60, $70 a month. In some cases, it can be at multiple $100s a month of additional charges on your Medicare Part B premium. There's also a little bit of extra charges they tack on to your Medicare Part D, as in dog coverage, as well. So in a sense, if you make too high of an income, they do punish you with the Medicare IRMA, and that is something that people that apply for in that circumstance, that qualify for that, don't usually see coming because people don't talk about it nearly enough. What do you think about these unexpected penalties and expenses that come with getting onto Medicare, not enrolling at this right time? Leave your comments down below. What do you think about them? Do you think they're wrong? Do you think the government should not be doing lifetime penalties or penalties that make you pay more for your Medicare if you make too much of an income? What is your opinion about this? We'd love to have a dialogue with you. If you found this video helpful, insightful, educational, and warned you about these particular things, do us a favor, smash the like button for the YouTube algorithm. It's going to help so many more people just like you find this video who need to hear this information. Make sure to subscribe. We put out weekly videos to help you out with your Medicare and bring you this type of information when not as many others are willing to do so. We'll see you next time. Thanks so much for watching all the way to the end, everyone, and happy Medicare.